Hi folks, got a good question for you. Very logical question. Dear Dr. Mike, why don't you have a well and sick waiting room? They should be separated. That way the sick kids won't infect everybody else. Great question. So first I'll just start with the objective data, the standards. So the American Academy of Pediatrics, I'm going to read their statement on this. It says, this is the statement for controlling infection in pediatric offices. So it says, no studies document the need for or benefit of separate waiting areas for well and ill children. And I think I can clarify a little bit more. So first of all, there's no studies to say separating kids in the waiting room decreases the transmission of any illnesses. So that's first and foremost. But if you get a little bit more specific, you have to look at it this way, and that is all sick kids are not created equal. So if a child comes in for a sick visit, he or she could have a headache, allergies, urinary tract infection, sprained ankle. So those kids come in for a sick visit, but they're not really infectious or contagious, but they're still sick. So then those sick kids would be with the other sick kids who would come in with cold, fever, flu, runny nose, things like that. So it doesn't really protect all sick children by separating them out. On the other hand, all well kids are not created equal. You could have a well child that comes in that's sitting in the waiting room waiting to be seen, but all of his siblings are sick. So now you've got his brothers and sisters hacking, or parents for that matter, spreading disease on the well side. What else is very common is the kids come in for a well check, and then the parents will say, yeah, and by the way, he's had a cough and a cold, a little really mild for the last few days. So that kid who was coming in for a well check was actually in the waiting room on the well side with a cough and cold. So in a perfect world, every well check would be perfectly healthy and every sick check would be very clear, so we could sequester them out or put them away. But it's just not realistic, because if you really want to be dogmatic about this, there should be the well side, then the well sick side, then the sick side, then the sick side. And it's just not practical. So that's the answer. The other, maybe more practical answer is that you're here for about ideally 20-30 minutes. You have some transient contact with the other kids here, but you probably the kids aren't going to be physically exposed to other kids a lot here. Where they will be is usually at home to sick siblings, or grocery, or restaurants, or place of worship, or daycare, or school. So that's the bottom line of why we don't do it. I hope that answers your question, and have a great week. Bye-bye.